and welcome to Lifetime Partners, where we create relationships for life and interview leading experts across the planet in their respective fields. My name is Letitia Pennington, and I'm greatly honoured to have with us today Dr. Michael Bagnell, all the way from Pinecrest, Florida. Is that correct, Doctor?
That is correct. On the opposite side of the earth, I believe.
We are. And the time over there is roughly the afternoon for you.
No, morning time, actually.
Oh, morning. Oh, great. All right. Well, just a little bit of history about Dr. Michael for our listeners here today. So you've obviously practiced in Pinecrest, Florida for over 32 years. You've achieved a diplomat status in chiropractic neurology and completed a fellowship in brain injury rehabilitation. You're also a board certified in neurofeedback and sitting the board certification for use in hyperbaric oxygen therapy this month. And you also offer the brain camp in Florida Keys there with the dolphins. That's really exciting. Yeah, I can't wait to speak about that. And you really take your brain-based healthcare and blend that world of functional medicine and physical medicine with clinical neuroscience. And you also teach that throughout the USA. Is that correct as well?
Correct, yes. We were scheduled to be in Europe last year, but everything got shut down. So hopefully around the next year, maybe we'll be able to take this internationally.
Excellent. So that will be, that's fascinating. And is that the research you're doing specifically in brain injury rehabilitation? Is that correct? Or?
It is. It actually is kind of something that's a continuum. And I'm sure we'll talk about this, from brain injuries to improving brain performance without having an injury. So we want to be able to help, improve the function of our brain, because like many say, I mean, everything that we do is a function of our brain. Our ability to come on here and talk and move through the day and have emotional relationships and connections, and what we choose to put in our mouth for food and what addictions we might develop is all a function of our brain. So yes, we deal with people with many different brain-based conditions and brain injuries. And we're also seeing more people contacting us to improve their brain function, what we like to call resiliency. How can we strengthen brain networks and build resiliency of the brain so that it can deal with the oncoming onslaught of human living?
Wow. Okay. Yeah, because it is correct. You graduated from, I know you said it was a while ago, but from Life Chiropractic. And as far as I'm aware, I've been taught, but the brain is the master controller of the body. So
correct. Yes. Yeah.
Explain that a little bit here for our viewers.
There's an organization in the States, brainfacts.org, brainfacts.org, and it's got some wonderful fact-based information on there that it's just really interesting. You could call it cocktail talk. You can drop a few of those, but I find it fascinating because I'm a bit of a brain nerd. But we can say that the brain is the body's most complex organ. The brain is the body's most complex organ. In fact, I was just teaching on, believe it or not, sexual ethics and the brain in a conference to colleagues. And one of the quoted statements is that the brain is the body's sexiest organ because it's the thing that gives us desire and emotion. So I thought that was quite cute. But it is the body's most complex organ. It's the only organ that you could say studies itself. That's kind of a fascinating little ism on the side. But, the brain is really so unique in the amount of cells, the way it functions and interacts and gets information back from the gut. I know you talked about that with Dr. Kirshner, I believe. And the brain is getting information all the time. And it's your simulator. It's your CEO, I guess you might call it, your executive function. So, yes, my journey's been an interesting one, from chiropractic and physical medicine into neurology, and really how chiropractic affects the brain, because we think, and most people around the world, if they have any exposure to chiropractic, I think a little light bulb goes off in their head, right? Chiropractic, that's the spine. But in actuality, the effect, and actually one of the best researchers in the world is in your neck of the woods, Dr. Heidi Havik, down there in New Zealand. And she's showing that the work that we do, manipulation, adjustment, whatever you prefer the name, affects the brain in a very unique way. So in a very correct and scientific way, we could say that physical medicine has a profound impact on brain function.
Yes, definitely. I'm a big believer in that, and I've learned so much research myself. But yes, I see chiropractic now as a neurological
Yes.
treatment as well as as an adjustment to correct that through the spine. So, hopefully,
Right. Yes.
yeah, yeah.
Very
So
good.
the neurofeedback process, you correct me, but could you explain to me just the neurofeedback? How are you collecting that data? Is it the motor neurons? Is there a way that you can test that and then find patterns in that? So we have
Yes.
an afferent and an efferent messaging system. Is it
Hmm.
that what you're tapping into, or how are you
Well,
doing?
we put a cap on the head,
Yes.
and it is used in standard neurology as well. It's used in what we work with. And what we want to do is we want to listen to the electrical activity of the brain. You could say it that way. The cap is recording what's coming off, and it's hooked to an amplifier in the computer. And
Mm-hmm.
so we're listening to what kind of brain waves, what oscillations that afferent efferent is having inside the brain. It's actually the pyramidal cells of the brain. It's very fancy names, but you know these things. Maybe listeners will say, I don't know what that is. It's brain neurons, and they're firing and they're oscillating, kind of like your heart is beating all the time. And you could see a rhythm on an EEG. Well, an EEG for the heart, electrocardiogram, but an EKG, EKG, EEG, I had it flipped. So we're recording the electrical activity of the brain, and then we're looking at it and comparing it to a normative database that we use two, one in Amsterdam and one in New York, NYU University. And we're looking at that compared to your age and gender match to see if are your brain waves in a realm of normal function, meaning 1.5 standard deviations above and below 1.5. That's considered a normal range. I heard someone yesterday on Clubhouse, we were just chatting about brain injury recovery, that there is no normal. I said, well, there is a normative range. Okay, so let's be grounded in some science here and understanding there's a range of normalcy. So we can compare the electrical activity of the brain to this range of normalcy for a female and male, what age, child, adult. And then that is one piece of many different metrics that we would analyze for someone's healthy brain function.
So yeah, of course, and that I mean, really, you're saying it's no different to taking some blood work and knowing that we have a standard that we work in
Exactly.
with a low and a high, and you're basically mapping that. So
Right, exactly.
okay, perfect. And so I don't know. The one question I don't know is the hyperbaric oxygen therapy. How is
Yeah.
that now tied into what you're doing? How is
So we use, right, that's a great question because I'm about to sit that board and we're bringing that hyperbaric and getting it installed in a couple of weeks here. So we know that pressurized oxygen can help saturate more oxygen to the tissues. We know that the brain needs two things, fuel and activation. So fuel is of course, your blood sugar, glucose, and oxygen. If you're deprived of oxygen, we know that that's a major catastrophe for the brain.
Mhm.
And we know that the oxygen carrying capacity of our body is based on red blood cells and iron and hemoglobin and so forth. But we can actually put people into these pressurized chambers and bring the oxygen even to a greater level for them, which in theory, and actually in numerous cases and conditions around the world, we've seen that there's improvement in those conditions.
Mm.
So using the hyperbaric oxygen by itself can be a great benefit. But using it in conjunction with things like neurofeedback, proper nutrition, balancing out metabolic things through functional medicine, and then training the brain through other types of activities we do in functional neurology, we get a very strong alteration, improvement in the brain function, and we target that. So it's not general brain training, like perhaps you might say, you're going to do a game on your computer for your brain. And that's not a bad idea. Or you're going to do crossword puzzles, or I'm not sure what they do in New Zealand. I mean, I love to see.
Oh, I think we're in.
Yeah, I mean, pretty much we're human beings, so we have some similar types of things we believe. I'm going to play an instrument. I'm going to learn a language, and those are good, and you might pursue those. But we will target things for people. So the difference is, it's like you go to the gym and you just do a variety of exercises, or you come to someone who's a trainer and you say, I want to increase my strengthen my back, strengthen my legs and my core, and I want to lose some weight. Okay, we're going to do these 4 exercises, and this is what you're going to eat. It's very precise. So our brain training approach for resilience or injury recovery is very targeted, and hyperbaric oxygen is one component of that.
Correct. And it has been around for a while, though, hasn't it? So we've obviously
Yes.
increased this.
Yeah, it's been around. It's been mostly used in the past for people that have diving injuries, where they get down and they get the bends, right? They get oxygen that gets into the wrong place, or nitrogen, and so they need to be decompressed. And then they started to see that, there's more applications for this. So yes, it's been around for quite a bit of time.
And as an athlete, is any of this, especially the neurofeedback process that you run through, if I was to come to you as an athlete, as a high performance athlete, or even just wanting to improve my speed, is this something that you would also work with? I mean, we're not just talking about some of the other neurological issues that you deal with, correct?
Right. Correct. Yeah, absolutely. There are numerous professional athletes and organizations in the States and perhaps around the world, I'm just not familiar with them, that are using hyperbaric oxygen for recovery. They're using many things, trying to shorten the window of their recovery so they can perform at a higher level, with compression boots and ice baths and cryotherapy and all these, and red light therapy. There's many things that can help. But yes, it is one of those things that we would do with brain training, neurofeedback, and with hyperbaric and several other things to improve performance. Yes, reaction time. Yes, visual and perception in your environment, so you can respond to things on a broader way. The calming down of the brain, so you can be in the quote unquote zone, right? Is more of an alpha level frequency. So you can uptrain, they call it. You can train alpha to be stronger in your brain so that you can really be in that zone quicker.
Fascinating. I'm quite fascinated by it. So
we got to get you to the States, or we got to get me down there so we can get some, training and exciting. It's really wonderful to engage in it, and experience it is really a unique opportunity.
Oh, I'd love that. I would. So as far as you also do have this dolphin camp. Now,
yes.
this is interesting. So do you really use it for, I know you see a lot of ADHD, some anxiety, depression,
right.
And we know that dopamine is released, and usually that's in a stress-free environment. Now, is this program designed just for this process, or are you actually doing other studying, other training within it as well?
Well, the camp is designed and came out of some clients that we have here in our office that have been friends and clients and patients for a long time, and they are mutual owners of dolphin habitats around the world, in Italy and Israel and Florida and so forth, and different places, Jamaica and the Caribbean. And they came to me and they said, is it possible for you to design your work in conjunction? Because they've had people work with physical therapy with children with disabilities and occupational therapy. And so we ended up spending most of the summer, this was 2019, going back and forth. I'm about an hour and 45 minutes from the facility, from my office. Okay. So we would drive down, spend the day, get in the water with the dolphins and the marine mammal specialists. And as we talked and we had lunch and talked about what the dolphins can do and the functions and what we were looking to do, we developed in-water activities that will affect a human being's brain by working with the dolphins in a particular way. Amazing. And so we do land-based training. So it would look like this. Latasha would come to Miami, and you would be here, and we would evaluate all these areas of your brain function. And on Monday, we would be working in the office for multiple sessions through that day, approximately 3 hours of working with you, different sessions with breaks, and you have lunch, on training your brain to these targeted regions and improving it. And then on Tuesday, we would drive down with the rest of the people in the camp to the Keys. And we'd spend the day in the water and then having lunch and then in the water again. So about 2.5 hours in the water with the dolphins split up, doing activities designed for you, that the dolphins would do with you. And then Wednesday, you're back in Miami and you do another full day in our office where we're measuring things, seeing the changes. Then Thursday, we repeat. We're back down in the Keys for another 2.5 hours with the Dolphins. And then Friday, you're back up in Miami. And by that time, you're pleasantly exhausted. Your amygdala is very calmed down. You have these experiences that are really, I mean, I've never jumped out of an aircraft, skydive, but the experience in the water with the dolphins, numerous people and myself, what is really remarkable. It's one of those things you say, that's just something I can't even hardly put words to it because it touches you deeply. They're remarkable creatures. And it's not one time, right? You're in and you're out and you're in. And so you start to develop some bonds with them. And so at the end of the week, we measure all the changes and then we send you back off but we send you back off to your home, hopefully with brain improvement, which we've measured and we've documented as research.
Brilliant.
But one thing happens, you end up leaving one thing here. You leave your heart with those dolphins. That's what people say.
I bet you do, because you would form quite a close connection.
Yeah, you really do.
Yeah. Oh, it's just amazing what you're doing, Dr. Michael.
It's fun. We enjoy that.
Yeah, I bet you do. Are you what? I mean, there's so many things that we can talk about here today. We have limited time here, so some personal questions, though. I mean, I've seen a few interviews now with you and your wife, and is she part of your team? Is she part of your work? I mean, she is anyway.
Yeah, she is. She and I started this journey together 30 years ago, working together. She actually is a professional photographer and coach. She's a life coach. And so that's something that she does really remarkably. And she just infuses that into the work with our clients here because people have issues. We all have issues. We're complicated beings. And sometimes we're a little bit peculiar like me. But yes, she is our center director here. So she's the one that will have a first meeting with somebody who's interested in any type of work with us or coaching with me, like we coach doctors and mentor them and others around the world. But she'll kind of handle the beginning process and she'll find out if we're a good fit for people, whether it's for their health or for their mentorship. And so she's the centerpiece of what we do, I would say. And so, yeah, she does work here. Among the other things she does, she's a Renaissance woman to the utmost.
Good answer. And sounds like you both are amazing and making quite a difference there.
Thank you.
Yeah, so thank you. In medicine today, you must you do. I know you research a lot, and like you said, you are traveling, or the plan is to travel to Europe to take this work of yours with you. So again, is this lecturing to doctors specifically and specialists in this area? And
no, it will be opened up. Yeah, it'll be opened up to many different types of health-related professions, clinicians, therapists, doctors, mental health, whatever. As far as we're concerned, there'll be a module, you could say, or a presentation or time that would really be for more people that are in the medical field or working with some type of counseling, medical health, coaching. Yeah. And then there'll be more of a lay session for people. Of course, we always feel that's so people can come and understand on a level that is appropriate for them. Okay. So yes, that's always a component of our, when we go out to, or at least it's the plan component.
Yeah. And one question now, just moving forward, because we are coming to the end of this, but if there was one improvement within medicine today, or within the work that you're doing, and I'm putting you on the spot a little bit, but I'm sure you've thought about it.
All right.
I'm sure you've thought about it, but what would that one improvement be for you that you would like to see, happen within the profession itself, or within the research you're doing?
In healthcare in general, you mean?
In general. I think in general.
Well, let's see. That's it.
It's a tough question.
It's an interesting question. I'm not really. I'll say it this way. I appreciate that many people say, I am on a journey to change healthcare. I am on a journey to improve all of mankind. And genuinely, I feel that that's their heart, right? That's something it's a burning desire with them. For me, I think if there was something we could alter about healthcare, it would be, I think the most significant thing in my thoughts would be that we would consider people tripartite. Instead of just a body, that we are tripartite. And what I mean by that is that we're a body, we have a soul, and the deepest part of every human being, whatever their belief system is, they have a spirit.
Yeah.
And so I heard someone say this. He said, if you as physicians are taking care of the body and you're not paying any attention at all to the soul and the spirit of the person, 2/3 of them you're leaving unministered to, uncared for, unshepherded. So to have a mind for that, you might say, well, I'm not a person who's trained in that. Then get some training because, it's like saying, oh, I'm only going to work. I'm a chiropractor. I'm only going to work on this bone right here. And, oh, you have depression. That's not my job. Oh, you have pain in your foot. That's not my job. Oh, you have really poor gut health and you're obese. That's not my job. Okay, listen, when you take this position, I like my work to always be simpler. I mean, I don't want to take a lot of notes. But the reality is it's not that way, Mike. You're going to have to care for people and you're going to have to shepherd them and you're going to have to walk the road that some don't get better. So I think that if we could infuse a little more empathy, but see, it comes personally, doesn't it? Mm-hmm. If I don't grow, so I have to grow as a person so that my capacity to care for people is enlarged. Mm-hmm. You can be the smartest person and have the worst bedside manner. And we've met some of those, all of us, I probably have been that at one point, but if we could understand that empathy is a very important part, kind of like, I guess, as an example, the situation with COVID, right? Take the vaccine. Okay, that's what you want to do. That's a personal decision. But what else are you doing with your health?
Yeah.
It's like, okay, there's many other factors that we know are critically important because those that had comorbidities ended up with worse outcomes. So in that way, you're a physician, but also care for the rest of the person, body, soul, and spirit. And empathy is a great window into that.
I love that. Thank you.
You're welcome.
Thank you so much. So yeah, this is mind, body, spirit. Totally correct. And I think that is what is lacking a little bit, not a lot, but I just think we shy away from it rather than face it.
Right. Yeah. I think as doctors, we tend to shy away. We're thinking, and it may just be due to our not being exposed to a proper view of that. Maybe that's it.
Yeah. Oh, great. This is too short. I would love to have another with you, definitely over the next coming months. I think there's lots more that we can discuss. I know. Yes. So are you regularly on Clubhouse now, are you? Or
I am getting on there more often. My wife tells me, okay, that's enough. But I'm okay, what do you do? I said, they invited me and it's about the brain. So just briefly, but I'm ending up, and we're going to actually we have a room that we're going to be starting here in about 2 weeks.
Okay.
It's going to be called the Brain Lab, Brain Lab. So people want to look for that because it will be talking about many, many things that relate to the brain. As you mentioned in the beginning, the things that give feedback to the brain and then the outcomes. And so there's many components to that. And there's a lot of wonderful rooms like that. And we'll have some interesting guests. So we'll look forward to that.
Oh, that's exciting. Oh, I'm glad that we brought that up here today. So that's good. Now people can contact you. You do have an amazing website. So that's at Bagnell. Is it?
BagnellBrainCenter.com. Bagnell Brain Center, right? There it is.
There it is right there. I'm just looking at it.
I made it easy. Yeah.
That's right. I'm just looking at it now. So that's the website.com. So people can definitely go there, have a look. You're all welcome to contact me as well if you have any questions. And I I really hope we have another interview very shortly, Dr. Michael. But I know you're busy. I know you're busy and you have to go. So thank you so much for joining us today. I really appreciate that. And
my pleasure.
And all the work that you're doing. So
can't wait to visit New Zealand. That is one thing I really would look forward to. So we'll see.
We'll see. And vice versa.
Right. Cheers. Okay. Yes.
All right. Thank you so much.
My dear.
All right.
Thank you.
Bye.